Hi, I'm Dr. Monica Jauregui, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live fully. Ready to explore what's possible and be truly healthy? Welcome back to the Truly Healthy MD podcast. Thank you to all those listeners out there. Today, I have the great privilege of having Dr. Neil Nathan on the show today. Dr. Neil Nathan, MD, he has been practicing medicine for over 50 years. He has been board certified in family practice and pain management and is a founding diplomat for the American Board of Integrative Holistic Medicine and a founding diplomat of the ISEAI, which stands for the International Society of Environmental Acquired Illnesses, if I remember correctly. He has written several books. Some of these are Healing is Possible, New Hope for Chronic Fatigue, Myalgia, Persistent Pain, and Other Chronic Illnesses. Another book is on hope and healing for those who have fallen through the medical cracks. He has multiple books. The first one that I started reading was this one, Toxic, which changed my entire life and my practice. We'll talk a little bit more about that later. Thank you for being here, Dr. Nathan.
Thanks for having me, Monica.
So I know that you have a lot of publications out there, and I have read your most recent book once, and I'm planning on reading it again because it was just so much. Can you tell us a little bit more about this latest book that you wrote, The Sensitive Patient's Healing Guide, and what your message is to the audience about potential readers about this book?
Well, let's start with what I mean by sensitive patients. I'm not really talking about sensitive in the context of does this outfit make me look fat? That's not what I'm talking about. I'm talking about true sensitivity of the nervous system, where people have developed sensitivity to light, sound, touch, food, EMFs, and especially chemicals and smells. So we're talking about the different senses that we have becoming hyper-reactive. So these are folks who find that they sometimes are so sensitive to light that they need to wear sunglasses inside their homes. These are people where a sound that wouldn't bother most people will startle them or make them jump or make them feel like they need to leave the room. These are people who, if they're going down the detergent aisle in the grocery store, and it literally makes them weak, brain fog, can't think straight, immediately on contact with those smells or senses. And that is not a rare thing. There's a recent study in England, by the way, that showed that 1% of the English population was on disability because of the intensity of these sensitivities to smell as a particular issue, and that up to 35% of the entire population had some degree of chemical sensitivity from smell. So we're not talking about something where, oh, there's only a handful of people like this. We're talking that it's way more common than people realize. And increasingly, we're also talking about people who've become sensitive to EMFs, which is electromagnetic frequencies. This means people who find that if they're on their computer or cell phone for more than a few minutes, again, they will get fatigued or brain fog. And in severe cases, may even have things like seizures from this reaction. So this is becoming increasingly severe and increasingly common. And these are the folks that I'm trying to reach to help them understand that we have begun to understand the physiology behind this and how to treat it successfully. So that's why I wrote Sensitive Patients Healing Guide, to help these folks to understand because most of them have been marginalized or denigrated or put down by their doctors, families, friends, and with the concept of, oh, you're just too sensitive, buck up. And that's not it. We're talking about a nervous system that is not functioning properly in an effort to help protect that person, but have become overprotective. And now it's making them have difficulty navigating through the world. So not rare, very important. And I just wanted people to know we do understand this now. We didn't 20 years ago, but we do understand it now and we can do something about it.
Yeah, I think that's so important for people to understand. I completely agree with you that there's just not enough awareness regarding that amongst the public and amongst physicians. And people often don't feel heard when they're talking to their family members, when they're talking to their physicians about this. So your work is phenomenal. And it's sadly something that more and more people need. Just a personal story. I remember my mother always saying that she could not tolerate the smell of toilet paper. It would make her like pass out, like the scented toilet paper. And so I always thought that was so weird of her, but we didn't know how sick she was until I became a physician and I started learning about all these things, and things that I learned through you have helped me help my mom. And she's much less of a sensitive person. She can tolerate odors that she couldn't tolerate before. She doesn't feel like she has to pass out if she's smelling scented toilet paper. I know it's a very specific, weird thing, but that just really made a big impact in my childhood. And it's unfortunately something that more people are dealing with as our world becomes more toxic.
Yeah, very much so. Again, this is more common than people realize. And there's a tendency for people to go to view the world through their own perspective, which is, I'm being exposed to this smell and I'm fine. What's your problem? Meaning, implication is always that it's in someone's head, but it's not. This is not a psychological issue. This is a neurological issue in which that nervous system has become hyper-reactive or hyper-responsive. The word we use is hyper-vigilant to some of these stimuli. And here's the good news. We can fix this. Just because you're in that state doesn't mean you have to stay in that state. It helps to understand the causes of how that comes about, because we can really do something big time about it. So that these folks who have had trouble living in their current environment can now live a full, happy, vibrant life once they understand how to fix it.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support. Absolutely, absolutely. And as you say, it is a disease that's, it has a lot to do with the nervous system, but you've also taught me that it has to do with other parts of their body, like their mast cells. I learned from you what mast cell activation syndrome was, and obviously this is not something that you came up with. This is something that is known to conventional medicine. They just don't understand how common it is. So I think it's important for our listeners to understand that it's their nervous system, it's their mast cells, it's their vagal system. So how do you explain to a person that hasn't heard about mast cells or mast cell activation what that is?
There, I try to first paint a bigger perspective, and you're mentioning all of them.
Yes.
There are three main components to the creation of sensitivity, and they are our limbic system, which is a part of the brain, vagal nerve system, which is a part of the brain, and mast cells, which is a cellular defense mechanism that is all over our body. So all three things need to be understood so that you get where this is coming from. And here's the complicated part. All three of these systems, limbic, vagal, and mast cell systems, completely interweave with each other. They're completely interrelated. So it isn't that you treat one of them. You kind of have to treat all three concurrently and simultaneously to quiet it down, and that allows people to heal. But more directly to mast cells. Mast cell is a type of white blood cell they're located throughout our whole body, in every tissue of our body. It's especially prevalent in the parts of our body that connect to the outside world, because that's their defense mechanism. So that means sinuses, our esophagus, our whole intestinal tract, the vaginal area, all the surfaces of the body that come in contact with the outside world have a particularly high amount of mast cells. When mast cells become activated, and we can talk about more of what does that, and that is not rare, by the way. Once again, I'm not talking about a rare event. We used to think it was rare, and recently with research, it's been shown that somewhere in between 15 and 20% of all of us have some degree of mast cell activation going on. It's not rare at all. But it would be particularly obvious where if you swallow something, you would immediately, and I mean even while you're eating or within 5-10 minutes after eating, you would develop itching, hives, a rash, fatigue, cognitive impairment, sweating, palpitations, abdominal pain. Those kinds of symptoms, when they come on immediately, are almost always mast cell activation. They're not allergy. The assumption that most people have is that they're allergy, which is okay, I just put this in my body and I'm reacting, so I must be allergic to it. But here's the confusing part. Whatever you just ate, you could eat the same thing tomorrow and not react to it. And today you do, because mast cell activation fluctuates. For example, mast cell activation is triggered a lot by mold toxicity. Now, mold toxins fluctuate in their level in the body. So if they're particularly high one day, the mast cells will be activated, and the next day they may not be. So it's very confusing to people, which is, I ate this particular food today and I reacted, and the next day I ate it and I didn't react. Well, what's going on here? That is classical mast cell activation.
Yeah, and I think that's confusing to some people because one, most people haven't even heard of mast cells, but also the fact that there's not a typical lab test. When people think they're having an allergic reaction, they might go see an allergist and they test negative for the IgEs. And so they might be told that they aren't having a reaction, but they really are having a reaction. And it's the symptoms fluctuate. The labs to figure this out are not as straightforward. It's more, there are labs, but it's more of a clinical diagnosis in most situations. And so it can be a very confusing thing. And it's also confusing because it can present in so many ways that it can change in the same person and it can be different from one person to the next. So it's something that is difficult for a lot of people to wrap their brain around. And I love the way that you explain these things. It makes it easier for us to understand the way that you explain it to us.
Well, when mast cells get activated, they can release up to 1,000 different biochemical mediators into the body, which means we're all unique genetically and biochemically. So the effect of those things will vary from one person to another. So one person might get hives or a rash. Another person might have wheezing or difficulty breathing. Now, these things look like allergy, but actually they're not. They're biochemically related, but they're not really the same thing. And here's the good news. It can be treated. Now, the whole medical profession didn't really understand or even hear about mast cell activation till maybe 2016 with the
Wow.
publication of the book, Never Bet Against Occam.
Dr. Afrin, right?
That's right, Larry Afrin's book, which for me, I read the book and I went, whoa, I have been missing this, and I have been missing this a lot. And in response to this, there's now a mast cell clinic in almost every university major medical center in the country. It's gone viral in the sense that, okay, now everyone's thinking about mast cell activation as a very real thing. It's really very common. Here's the problem. Many people think about mast cell activation as a separate illness, like, oh, I have mast cell activation. Problem is, it is something that is being caused by something else. So if you just treat mast cell activation, and we can, you can get better, but you can't get cured of it until you get what is causing it fixed. And that's really a point that I want to make, which is the two main things that will trigger mast cell activation, in my experience, are mold toxicity and Lyme disease with its co-infections. EMFs can trigger them. Some viral infections can trigger them. There's some other infections that can trigger them. There's some other toxins that can trigger them. But by far, mold toxicity and Lyme are the two most common. If you're not looking for the cause, then you're not doing yourself a favor, because you really want to cure it. And here's the beauty, which is if we cure the mold or the Lyme disease or whatever is triggering it, you won't have mast cell activation anymore. It is something that is completely curable if we look for the cause.
Absolutely. And the whole process of looking for the cause and finding it and treating it is a pretty long process, even in the most experienced clinician's hands, is my assessment. I think you would say that too. So fortunately, there are some things that we can do to help people out to control the symptoms while they're in the process of figuring that out, right? We have things that stabilize these mast cells and help them be less trigger happy. So there's ways we can help people even before we get to root causes, but we ultimately want to get to those root causes so that we can help people heal. That's the whole point of what we do, not just palliate symptoms, but to help people heal.
Yeah, and I think that's critical. Every single thing that Monica and I are talking about today is treatable. So it isn't that, I'm sorry, you have this bad disease and I can't do anything about it. Every single thing we're going to be talking about today is treatable. And that's really the take-home message.
Absolutely. I think that's an important take-home message because a lot of people feel like they are doomed to have a chronic illness, and they kind of it's hard. It's very hard to have a chronic illness, and they it affects them in a way where they take on it the identity of being a chronically ill person. And one of the main ways I try to help my patients is to understand that they are not their disease. They have a series of symptoms and they have a disease, but these things are curable. And so that message is something that is very important for me to tell my patients when they first start working with me, that we're going to do everything we can to help them heal.
Resounding yes.
Absolutely. So back to the premise of what you were saying. You were saying that we have these three things that interplay in our body. The mast cells, which we've talked about, we could keep talking about this forever, but just to make sure that we're giving our listeners a balanced view, there's the limbic system and the vagus nerve, the vagal system. Which one should we explain next to our listeners? Because many of them may not know what these things are.
Right. Sorry about the fancy words, but once you understand what we're talking about, it's the limbic system is a part of our brain that is designed to keep us safe. And the way it keeps us safe is by monitoring the stimuli that we're being exposed to. Now, those stimuli are external stimuli, things like light, sound, smell, chemicals, food, you name it, and internal stimuli, kind of things that we feel inside. So basically, the limbic system is monitoring our stimuli from the perspective of safety. And if that system doesn't think we're safe, it's going to shut us down, not to make us sick, but to wake us up to the realization that, hey, I'm not sure you're safe. I think you're getting threatened by something and you need to wake up to that realization. Now, the limbic system and the vagal system both do this. Now, they're separate parts of the brain and they operate differently. The limbic system does it by giving us symptoms in two main categories. One is sensitization, and the other one is emotion. So if you have begun to get more sensitive to light or sound or chemicals or smell or touch or EMFs, that's limbic by definition. If you have become more emotional, if you were not previously anxious or depressed, but you are now, so anxiety, depression, OCD, mood swings, depersonalization, derealization, which are fancy words for just not feeling yourself, like I don't feel like I'm me anymore. These are very real things, but they're governed by the limbic system. And any combination of emotional or sensitization things tells us by definition that this is a limbic system that needs to be rebooted. Now, this is not psychological, although people who are describing these are often told it's in their head. It is, but it's not psychological in their head, it's in their nervous system. So we literally have to reboot that. Now, on the vagal side, the vagus system is simply a name that is attributed to one particular cranial nerve called the vagus nerve. But it's actually a system of cranial nerves that are connected together. Now, the vagus nerve controls intestinal motility and digestion, so that any symptom that you have that's in that category, gas, distension, bloating, reflux, constipation, diarrhea, cramping, that has a likelihood that the vagus isn't functioning properly. It is also a central part of what we call our autonomic nervous system, which controls things that are automatic for us, like breathing, heart rate, pulse, temperature regulation. So if we're getting things like heart palpitations or arrhythmias, or if we're having trouble with shortness of breath, wheezing, might sound like asthma, but the vagus is almost always involved. And then temperature regulation, sleep, all these are central things that the brain controls. The vagus nerve controls that. So any symptoms in that category, any symptoms in the emotional category, in the sensitization category, tell us with certainty that these are two systems that are not operating properly and we need to reboot them.
Absolutely. Very, very important messages for people out there who may not understand why they feel the way they do. So many chronically ill people out there, probably sicker than they realize that they are. And it's hard for them to understand. Maybe they don't feel validated by their spouses, by the physicians that they've seen. And so these things are really complex. So these concepts, even though, like you said, they have complicated terms, it's essential that people understand what these things are so that they can understand that it's okay. It's okay to have these symptoms. It's not in their head. It is something that happens when you are become ill. And like you said, what you have found most in your practice is people become ill because of mycotoxins, because of Lyme disease, but it could be due to many other things that overwhelm the system.
Right. Any chronic illness is frightening to people. Understandably, it's like, oh my goodness, am I going to be seriously ill? Am I going to be debilitated? Is it going to lay me up? Is it going to stop me from doing my normal activities? Will this affect my job? Will this affect my family? It is not possible for a human being to have an illness and not have those concerns come at them. And again, those two systems are really about safety. So when we become concerned and worried about our future, safety it becomes prominent. You know, another player in this process of making our whole world less safe was COVID. COVID literally caused global panic and fear and is still not gone. And so many people aren't aware of how profoundly we have been affected by COVID, so that whatever else we were doing with got magnified by that same process.
Yes, absolutely. Um, so important. I mean, the good thing about COVID is that it helped a lot of people who didn't understand what you and I did pre-COVID. It helped bring to the forefront with all this long COVID thing, how people can be sick. And we've really been treating long everything before we had long COVID, right? And so there's been a lot of research and acceptance as far as these long conditions now that we have long COVID. But yeah, it was something that's been extremely impactful in our society and our world, and we're going to be recovering from it for a very long time. So just to circle back to some things that you said that I feel like are probably things that if this is the first time somebody out there is listening to these concepts, they're very, they can be complex, but I love the way you explain them. One thing that I want to talk a little bit more about is you mentioned that we need to reboot the limbic system, and uh, most people out there may not know what that means. Can you explain a little bit more what the process of rebooting the limbic system is?
Sure. When the limbic system is affected, every negative thought you have reinforces the neural circuitry of that same thing. That's a fancy way of saying every time you have a negative thought, it makes the limbic system even worse. And what do I mean by that? Well, all of us are beset by some negative thoughts. The more you can be aware of that, you can undo that and put positive thinking in, which breaks those circuits in the limbic system in the brain and literally reboots it. Now, there's a number of actual methods for doing that. Some have been around for a long time. The first two systems were Annie Hopper's dynamic neural retraining system, which was abbreviated DNRS, and Ashok Gupta's amygdala retraining program. The word amygdala is just another word for limbic. So these are two somewhat different ways, and listeners can literally go online and Google DNRS or Ashok Gupta or amygdala retraining systems, and you can get on those programs, they have introductory free videotapes of what you're looking at and what this constitutes. But essentially, Annie Hopper will lead you through a series of exercises and ways of thinking and monitoring your thoughts and changing them to reboot. Ashok Gupta will do it a little differently. He does what he calls meditations. They're really guided visualizations in which he will literally guide you into thinking into more positive ways. Now, some people mistakenly think, oh, I feel horrible and you want me to just imagine that I feel good. No, that's not what it's about. It's about understanding that you have to put positive imagery into the brain to reboot the system. Another program that I like a lot is Primal Trust by Kathleen King, which kind of combines some of both of those systems and adds a little bit more to it. But we have three main ways, and now the rest of the world has caught up and realized almost everybody needs limbic retraining just because of the scary world that we live in right now. So there's a whole lot of others that are coming out. These are the ones that have been around the longest, that I have the most experience with. And I can say categorically, I've had thousands of patients respond beautifully to that by getting well. The most obvious benefits are those people with either anxiety, depression, and chemical sensitivity. Now, sometimes the chemical sensitivity is very debilitating. Some of these folks can't go to church because some people are wearing scents or perfumes and they will be really sick if they expose it. Or sometimes they can't go shopping or they can't go out in public because they never know what they're going to get exposed to. The limbic retraining has profoundly rebooted their system so they're no longer anywhere near as sensitive and they can live normal lives. So this isn't just a nicety, this is an important component. Easily as important in our patients who have mold toxicity or Lyme disease, the mold toxicity and Lyme disease has triggered limbic, vagal, and mast cell issues. And if we don't deal with that first thing, we often can't make any progress with them. These are the patients who used to be able to take antibiotics for their Lyme disease or antibiotics for a bronchitis or a urinary infection. They can't anymore. Their bodies become too sensitive. These are people who become so sensitive that they can't even take a homeopathic successfully. So in order for them to be able to take the treatment that will cure what's triggering everything else, we need to first quiet down their limbic, vagal, and mast cell issues. So this is, as you said, complicated, But if you understand the pieces, what really matters is that you understand the order that you need to do the treatment in order to get successful healing.
Amazing, amazing. I think this is such a beacon of hope to many people who may be listening to these concepts for the first time and saying, wow, it's really not all in my head. It's treatable. And there's doctors out there with MD after their name that are acknowledging this. And yes, there are. There's more and more each day now that you've been such a trailblazer in this topic and you're mentoring many of us. And we're trying to move the science forward so that more people understand this. It's still something that's not, there's too few people that know about this in the general community amongst people with MD and DO after their name. And so I love being part of this movement that where people are understanding this more and more. It gives such a beacon of hope to so many people out there. What on that kind of segue, I feel like this is something new that has not made it into mainstream yet. Do you foresee this becoming mainstream anytime soon?
It better, because there's millions of people out there suffering here, and mainstream medicine needs to embrace this information so that they can help the people that are suffering with it. So we talked about triggers. Um, I talk a lot about mold toxicity just because it is one of the most common and diagnosable and treatable triggers that we've got here, and is super common. It's estimated that there are 10 million Americans right now suffer with some degree of mold toxicity. It's not rare. When people, the government has evaluated homes, and it is estimated that anywhere from 30 to 45% of all homes in this country have some degree of mold toxicity to them, where either it's visible mold, you can smell mold, or it's there. We're not talking about something rare. We're talking about something that people blow off. Like, oh yeah, there's this black mold around the windowsill, or yeah, I've got this black mold in my basement, big deal. Now, if your immune system is robust, you and your family can fend that off, live okay, not be affected by it. But if your immune system takes a hit, if you got COVID, for example, or if you got any other major flu, serious infection, needed surgery, had childbirth, or went through some major emotional upheavals in terms of loss of a loved one or betrayal by a friend, or you name it, once the immune system takes a hit, it loses containment, and the mold, which has been dormant in the body, fires up, and you can get people who are very, very sick. That illness is so complicated that if other doctors aren't aware of it, and despite how common it is, the vast majority of doctors are still not aware that mold toxicity is a real thing, or that it affects as many people as it does, because the symptoms of it are so widespread. Basic underpinning of mold toxicity is inflammation. And inflammation will affect all of us differently based on our different biochemistries and genetics. So for some people, it may take the form of anxiety and depression and OCD behaviors. For some people, it may take a neurological form, like peripheral neuropathy, insomnia. It will affect how the brain works cognitively. It's now realized by experts in Alzheimer's disease that a huge percentage of people who've been told they have Alzheimer's really have mold toxicity, and we can treat that, but that is still not known. The groundbreaking work of Dale Bredesen over the last dozen years published many, many papers in medical journals showing that you can evaluate and treat people with Alzheimer's in an effective way that current medications can't even begin to touch. Then we have GI symptoms, every GI symptom you can think, respiratory symptoms, wheezing, shortness of breath, air hunger, sinus infections, chronic sinus infections. Almost every part of the body can be affected by mold toxicity. And many of our patients have so many symptoms that if they go into the doctor, a doctor will say, oh, nobody could have that many symptoms. This has got to be in your head. No,
Absolutely.
this is not. This is mold toxicity. Now, Lyme disease can do something similar, but we're trying to help you all understand that if you have been suffering with a condition that hasn't been diagnosed, the two most common are mold toxicity and Lyme disease. And our tools for diagnosing these have gotten better and better, and our knowledge about how to treat it has gotten better and better. So I'm just trying to open up your understanding that what you've been suffering from may be as real as can be and treatable.
Absolutely. And you and I both know we could talk for days on end about the whole process of how people are diagnosed with mold toxicity, what the treatments are. It's a lot of times it's a urine test, binders, yada, yada, yada. That's a whole nother topic that I don't think we have time for today. I do want to talk about the fact that I feel it's important that we do everything we can to raise awareness about this and move science forward, help other scientific colleagues understand what we're doing, help the public understand what we're doing. I think a big thing is having research. Can you tell us about the research that's being done as far as mold IQ, what that is, who's leading that up, and what people should know about this?
Sure. Working with my teaching partner, Jill Krista, who is a fabulous naturopath, and Jill and I have, as Monica said, a mentorship program that's now about 250 physicians, in which we provide both the medical, I'll call it allopathic, although no one who knows me thinks I'm an allopath, um,
We're
and
we're
the
out. It's okay
approach.
to say it. It's not a dirty word.
It's become one in some circles. Um, so Jill wrote a wonderful book called Break the Mold, and in it, she put together a questionnaire to sort of figure out, depending on your answers to those questions, do you have mold toxicity? Um, Jill and I got funding to be able to do a major research project on making that questionnaire validated. So we expanded the questionnaire, and there is a website you can go to, which is simply called moldiq.org. Now, this needs to be done in concert with getting a mold test. We need to be sure that there is a mold test that confirms mold toxicity to validate that the way you're answering the questionnaire is giving us the information we need. So I'd love it if you all want to participate in it. That would be great. But be sure if you fill out the questionnaire, you're going to get a mold test within that next month. Now, mold tests you just have to have your doctor order it. It's not going to cost your doctor anything. If you have Medicare, it's free. So this is not for many people that expensive a test. And it's a urine test. It's simple. You just collect your first morning urine and send it into the lab for analysis. So we're not talking anything really complicated here. There are ways to do that test more accurately. If you will take glutathione for a while before you get the test, or if you do a hot bath or a sauna the night before you get the test, it's a bit more accurate. But you can do the test pretty well by just collecting your first morning urine and sending it in. So with that, and with the questionnaire completed, our research is that we're wanting to validate, and that, to those of you, that means that if we have enough people who've completed the questionnaire and done the test, statistically, we can prove that you have mold toxicity if you score a certain number on this particular test by answering the various questions that we're posing. And the questions are simple. It's about, do you have this symptom? Do you have this symptom? Do you have this symptom? Simple yes or no. And then we score it on we assign certain points. Some symptoms are more important or dramatic than others for doing that. Once we have this completed, and we're halfway through this now, we're getting there. Once we have this validated and published in a medical journal, those of us who practice this way can use this questionnaire to determine which of our treatments are the most effective. It's really important because at this point, we don't have NIH or the CDC funding our research, and we really need to. We're dealing with 10 million people who have this. This is a bigger epidemic than most anything that they deal with, but we need to do this research on our own to get it off the ground, to help the whole medical profession go, okay, you validated it, you've got research, published papers, we'll begin to take you more seriously.
Absolutely. And this is a project of yours that I feel very strongly about. I don't think I've ever told you this. I did tell Dr. Krista, I was sitting next to her at ILADS, and I was showing her my patient chart. And my main reminder for patients, have you done your mold IQ yet or not? That is like the alert that pops up. That's the only pop-up I have in my medical chart. Is I ask everybody in my practice who gets a mycotoxin test to please, please, please fill out the mold IQ. It's very important. People were aware if this was more accepted by mainstream. And so I am a huge supporter of this work that you're doing. And I definitely want to use this podcast as one of the ways that I'm helping get the word out. And I do it other ways too. I talk to my physician colleagues about this. And I really, really encourage anybody who's listening to this to go to the website. We'll make sure to have it in our show notes so that it's easy for you guys to access. It's tremendously important. It's not that hard to get a mold test. It's just a urine test. You do not need to go to, if you're afraid of needles, you don't need to get a lab draw. And it is something that's really, really going to help us move science forward. So I really, really am so thankful to you and Dr. Krista for putting this together, because I feel like it's the most powerful tool that we are going to have in the near future to help bring more awareness to the topic. I'm looking at my clock. We have been talking for I felt like 5 seconds, but we've been talking for a while now, and I feel like we could talk for hours and hours, and I would definitely not get bored. I think our listeners might need a break. So we're probably going to wrap it up pretty soon. Before we wrap things up, I do want to remind our listeners that Dr. Nathan has a website where he has some amazing resources. He has multiple books. That book that I showed you guys, Toxic, to me is something that I have next to me as I see patients, because I have to refer to it frequently to help guide me as I see these complex patients. I use many other resources too, but I do feel like it's one of the most valuable resources that I have amongst the many, many resources that I go to. So these are tremendous things that have helped me. They've helped my family recover from things that otherwise they would not have recovered. So I thank Dr. Nathan from the bottom of my heart for being a physician, a mentor, a human being. And so before we let you go, Dr. Nathan, if our listeners are a little bit overwhelmed with everything they heard, let's just do a little recap, a little summary of what a few take-home messages are, and then they can listen to the whole podcast all over again and buy all your books. How about that?
It works for me. Okay, so if you or a loved one is suffering with any type of a chronic illness, think about the possibility that there can be some causes for that that have not been explored. And the two most common are mold toxicity and Lyme disease. So if throughout the course of that chronic illness, you or a loved one or a friend or family member has developed anxiety or sensitivities or this mast cell activation where right after they eat, they begin to get these fairly awful symptoms, then think about the possibility that something that hasn't been uncovered yet is triggering in them limbic, vagal, and mast cell issues. So at the risk of being self-serving, I do think that reading my book, Toxic, would help you understand these things in more detail. And if you've gotten sensitivities, my newer book, which is a Sensitive Patient's Healing Guide, would help you understand that as well. Now, in that, there are answers for you. There are ways through this, but you'll need to find a physician who works in this field. That may not be
Absolutely.
as wonderful as the physician who you're working with is, If they don't know about this, then they won't be of much help to you. So you may want to look on my website for a list of physicians that I've trained, or you may need to find someone trained in what's called integrative medicine or functional medicine in order to find a physician where they will understand what we're talking about and go, oh, you need to get a urine mycotoxin test, or you need to get a Lyme test for mygenics in order for that to be an accurate way to know what's going on. So if you have been suffering, there may be answers out there for you. Please look into it, because I know that there are literally millions of people out there suffering that don't realize that we do have answers for you if you look in the right place.
That is absolutely true. I just want to give one more little thing that you said and just reiterate. I think there's many physicians out there. I know every physician that I've known in my entire career is doing, they're a physician because they want to help. If they don't have the tools, it's okay. It's not because they don't want to help. It's because they don't understand this yet. You can continue to work. You have to continue to work with your primary care. Even if you come see one of us, we typically don't take people on as primary care physicians. Continue to work with your primary care, but reach out to us that are trained in this, because just because your physician doesn't understand this does not mean that there aren't other people, physicians, nurse practitioners, PAs, many clinicians, licensed professionals who are understanding this more and more, and we're here to help you. And there is hope. It's a very lonely place to be when you have chronic illness, but there is hope. And thank you so much, Dr. Nathan. This has been such an amazing conversation, and I cannot wait to hear the feedback we get from our audience as far as what they think about this. I know that I loved every second of us being on this podcast.
Thanks, Monica. Always good to see you.
All right. We'll talk to you soon.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Jauregui, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feel your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.